welcome to everyone joining us for today's webinar on strengthening health systems by supporting innovative health businesses. I'm Tara O'Day, Health Officer and Private Sector Advisor at USAID, and I'll be moderating the discussion with our 4 expert panelists. This webinar is hosted by the USAID Local Health System Sustainability Project, which works to build sustainable, resilient health systems around the world. I'd like to start by just giving a brief background on why we hosted this Inclusive Health Access Prize and provide a summary of the prize itself. So despite many years of commitments from national governments and global health partners to improve access to and quality of primary health care, vulnerable populations in lower and middle income countries continue to face barriers to achieve better health outcomes. There is no single approach to achieving the goal of health for all, but we do think that countries stand a better chance when solutions and approaches are locally driven and include the cooperative efforts of public, private, and nonprofit sectors that deliver healthcare and public health interventions. In a high-performing health system, all people and communities have access to promotive, preventive, curative, rehabilitative, and palliative care of a sufficient quality to be effective, and it does not lead to financial hardship. High-performing health systems provide healthcare that is accountable, affordable, accessible, and reliable. While the global community convenes to tackle the topic of universal health coverage and health for all, USAID felt it was important to highlight the ingenuity and opportunity that comes when private, locally designed solutions partner with the public sector to promote, protect, and help maintain the health for all people. With that in mind, we designed the Inclusive Health Access Prize to recognize and incentivize scale-up and expansion of these solutions within and to other countries. We received nearly 400 applications from 68 different countries, demonstrating that a robust private sector stands ready to bring solutions that enhance the health system and can fill critical gaps in healthcare when integrated with public services. 11 finalists presented their innovative private sector solutions based on local contexts and needs that strive to make healthcare in their communities more accountable, affordable, accessible, and/or reliable. Finally, we were down to 5 winning organizations, all locally led and financed. While some were just getting started, others were more established, but they all had approaches that were designed specifically to fill a need that they identified within their local health system. Their ingenuity went beyond identifying the problem and its ramifications across the system. They used those observations and built on them by first understanding what is working within the how to build on those opportunities to enhance their success through the integration with existing resources. Their approaches demonstrated that private commercial sector, small and women-owned businesses, and civil society can provide new solutions that break down barriers to accessing health services. And the result is a strengthened health system that can deliver better health outcomes at an affordable cost and help counteract the negative effects of poor economic conditions on health. Today, we'll be hearing from 3 private sector health entrepreneurs who won USAID's Inclusive Health Access Prize. They're going to describe their innovations, which are making vital healthcare services more accessible to people, and they will discuss the challenges they've faced in scaling their solutions and how they worked with the LHSS Project to co-design technical assistance to strengthen their businesses. We'll also hear from LHSS Project's Senior Technical Advisor for Private Sector Engagement, April Warren, who tell us about lessons learned from the project's work with our prize winner. So that's it from me. I would like to start with Nneka Mobison, the co-founder and CEO of mDoc in Nigeria. Nneka, over to you.
Thank you so much, Tara, for the introduction. Good morning, good afternoon, good evening, everyone. I hope that you are all safe and well wherever you may be. And to my Muslim colleagues, Eid Mubarak. It's such a pleasure to be with some of my fellow USAID Inclusive Health Access Prize winners today to share with you our experience with LHSS. Next slide, please. As Tara shared, I'm Nneka Mobison. I'm co-founder and CEO of mDoc, a digital health social enterprise which leverages tech, data, behavioral science, and quality improvement methods to optimize the end-to-end self-care experience for people living with chronic health needs in sub-Saharan Africa. Next slide, please. We harness a 4-pillared approach, working hand in hand with public and private sector partners to provide self-care support to people living with NCDs such as diabetes, obesity, hypertension, cancer, comorbid depression and anxiety, and have expanded to other health needs such as pregnancy, given our preventive and promotive care focus. How do we work? Firstly, we leverage our omni-channel digital platform, Complete Health, to provide digital nudges and guidance to people on lifestyle modifications through our virtual coach-led multidisciplinary care team. Secondly, because mobile phone and smartphone penetration rates are not appropriate proxies for digital literacy, we have created in-person, what we call nudge hubs, in partnership with community-based organizations and health facilities, where our members can meet in person with coaches, track their metrics such as blood pressure, weight, and more, and learn how to use our digital platform. And thirdly, given people with chronic disease need in-person care from time to time, we have created a directory of providers, services, and facilities, essentially a Google Maps for quality care called Navi Health. And we've partnered, fourthly, with the University of New Mexico's Project ECHO to provide teleeducation to providers to increase the likelihood that when our members go to them, they're more likely to receive the right kind of care at the right time, in the right manner, all the time. Next slide, please. Today, we serve over 25,000 low-income members on our digital platform, Complete Health, across Nigeria, who on average make less than $3 a day. We have seen improvements in self-efficacy and behaviors with associated clinical outcomes such as average systolic blood pressure reduction, glycemic control, clinically significant weight loss, and so much more. Next slide, please. So at mDoc, presented with the everyday existential challenges of running an impact-driven startup social enterprise that's focused on addressing the gaps in healthcare in Nigeria, we realized that we had overlooked one extremely important set of choices for our long-term growth and scale strategy, which was organizational design. We understood that organizational design choices are key to creating a foundation for success and really important for mDoc to develop a strong company culture which could help us effectively scale. With TA from LHSS provided by MPA Global Advisors, we were able to develop an organizational strategy where we revisited and redefined our organizational values collectively with our entire team, and subsequently defined the behaviors and the competencies layered across a common global language that we all created. Through several workshops and sessions, we created a recruiting toolkit fully aligned with our values and behaviors, as well as the expected competencies, as well as a performance management framework and a compensation philosophy set of pieces of guidance to help us effectively build the foundation to not only recruit, but also onboard, support, and motivate our employees and ensure alignment at all times with our vision and mission. Next slide, please. On the left of this slide, you'll see the values that our team co-created. Some were already existing, while others were new, such as technology as an equalizer and curiosity to really push on our focus on problem solving. Our entire team valued the support immensely, with one of our team members even saying that it was the group therapy we never knew that we needed. We've learned a number of lessons from this, and I'll share 3 key ones. The first is, as a founder of an organization relying heavily on the productivity of our team, organizational design is our production process. Founders and leaders need to be just as obsessed with organizational design as we are with delivering impact-driven, affordable, and accessible person-centered quality services. The second is that for those of us who leverage human or user-centered design principles in augmenting service or program delivery externally, it's critical to leverage those same principles internally to co-create organizational strategy around culture and values with your teams to ensure full buy-in across the organization. And then the last lesson is that the reality is this is a journey. And oftentimes startup organizations that cannot afford a dedicated HR team need to identify individuals in the organization who can dedicate the time needed to spearhead the implementation of the organization strategy and institutionalize the people processes needed and so much more to ensure that a lasting foundation is built for impact-driven scale. Next slide, please. The reality is that we've only just begun this journey of establishing a solid foundation built on our redesigned values, behaviors, and competencies. Currently, we are implementing our performance management framework, and we're also exploring a potential proposal with the MPA Global Advisor team for additional funding support for our implementation. And at the same time, we're continuing to recruit for scale using our new framework. Next slide, please. So I just want to say a huge thank you on behalf of mDoc to USAID, LHSS, and the MPA Global Advisors team for the incredible support that we have had, which will continue to have an impact on us, and more importantly, on the members that we serve for years to come. Thank you.
Wonderful. Thank you, Nneka. It's impressive to see how you use tech to fill the gaps and expand access to palliative and preventive services for chronic disease. And also just noting how the TA supported your organizational structure and strategy redesign, and hopefully will support the buy-in of your team and as you roll out a strategic plan for scaling your innovations. So thank you again very much. Next, I'd like to welcome Adama Khan. He is CEO and founder of Joko Santé in Senegal. Adama, over to you.
Hello, everyone. Thank you. So my name is Adama Khan, and I'm from Senegal. And I'm the founder of Joko Santé. I'm a telecom engineer and the founder of Joko Santé. Next, please. First of all, I will try to explain what Joko Santé is about. So Joko Santé is a web and mobile app that allows people to have more access to the medicines, and we're doing this by first of all having a secure application, and this application can be used either with smartphone or with speakerphones, and people so they collect points on their account, and then they are able to buy the medicine in the official pharmacies, by paying with those points instead of paying with cash. And they can collect the points. They can purchase it by themselves, or they can those points can be offered by their employers, or by international NGOs, or by programs. And they also have a network of private pharmacy, and they can choose where to go and when to go to buy their medicine. And so what is important here is that, so we have introduced, a new way of paying medicines, and so by using those points, so we make all those transactions visible and trackable on real-time basis, meaning that so the international NGO, when they put their money, so they can follow it and track every dollar they put on our platform. And so it allow the money intended for help to go effectively to help. Next, please. So our solution has been awarded many times. We can say that maybe we are one of the most awarded African startup, but so we face many difficulties to grow, to scale up. And so we were wondering why, because we had many discussions with prospective investors, and so they do not invest in our solution. And we were really wondering, so why we are so successful and we cannot scale. And so this technical assistance to put light, on all, our hidden problems. So we went to so a capacity building, so a business assessment, and a broad market analysis, and we also built, scaling strategy with the advisor, and for deliverables. So we had a marketing deck that we share now with our partners and our prospective investors. Next. The main takeaways from this technical assistance is that now we know that, so we must focus on our business, and that's why people were not very keen to invest in our startup, because we were Princip has just like an NGO, and we know that. So now we have to focus also on our business model and to try to be the you know so to have a business so where people can put their investment. We also noticed that we need a formal advisory board because people, so we had many so renowned professors that, but they come and go, they don't stay in the team. And so we know that it is very important to have a formal advisory board that people can stay and then so accompany us for a long time. And we know that also some of our long-term strategy, so they so required investment in our business and also in our app, because our app, if we want to scale, so our app need to be more secure and so and now our new philosophy is that so we will wait to scale and then we'll be back to our social impact mission. So we'll be able to reconcile so the business and the social impact mission. Next. And so we have identified many next steps and many new revenue streams during this TA. So I'm going to talk about just the three. So you see on the screen. So the first of all is the direct international remittances. So for that, so we need to invest in building relationship with the diaspora work abroad in Europe and in the US mainly, and also in Africa, because there is also a huge diaspora in Africa. So the second one is about so using a tool we had in our platform, but we never used it. So it is a supply chain new platform. So we had it already in our platform, and now so we need to market it because we see that people they need it, especially so the procurement platform, so the Ministry of Health in every country, and so and so. And the third one is about the digital insurance management. So for that, we need to expand our product list and service list, and also test it in the real time. And I can say announce that. So we are about so finding closing a deal. So we maybe in 1 month we'll be able to do it on the real life. Okay, next, please. So we'd like to thank so the USAID team and the app team and also so our advisor from DHP. So it was really, really, really interesting, and we have really changed our mindset. Now we know that, so we must be sustainable to survive. Thank you so much.
Thank you, Adama, and thank you for sharing your innovative digital app to increase access to quality medicines. I really appreciate you sharing the challenges you faced in achieving scale and also the priorities that you identified from the TA process, including the need to focus on your business model and scaling, reconciling that with in the end, your mission. So thank you again for sharing. Our next speaker is Conrad Tanku. He is CEO and founder of GIC Spaces, and we'll be talking about JICMed. Welcome, Conrad. Over to you.
Thank you very much, Tara. Hello, everyone. I'm so happy to be taking part in this webinar to share on the wonderful mentorship and guidance we obtained under the LHSS program. And thank you all for joining. So I'm Conrad Tanku, founder and lead innovator at JICMed. Next slide, please. So a little background of what we do at JICMed. Our vision is actually to provide universal access to breast and cervical cancer care for women living in rural and underserved communities especially. And to achieve this, we have developed a series of medical technology innovations made up of a smart digital microscopy system, a smart speculum, a fine needle biopsy device, and a telemedicine platform. And these technologies enable medical specialists who are present almost entirely only in big cities, just a few big cities, to be able to remotely screen and diagnose women in rural communities, and all this occurring at the point of care. Then we go a step further to provide treatment for early stage cervical lesions at the point of care through a mobile treatment unit. So we actually implement our solutions in partnership with health centers and clinics present in target communities, using these health facilities as the main implementation sites and using their frontline nurses whom we train as the main implementers of the project at the point of care. So since the beginning, we have been able to work with up to 23 health centers up to now and impacted over 16,000 women to date. Next slide, please. So we received a huge technical assistance under the LHSS project, which helped us to do a complete autopsy of our organization. First, identifying our biggest pain points and weaknesses. Then it helped us navigate the process of obtaining the most appropriate solutions. So initially, we faced the problem of properly implementing our venture due to the fact that we are understaffed and lack some technical expertise which could help us manage certain tasks faster. But with the technical assistant, we were able to better define each team member's role, as well as define various KPIs, which has led so far to improved efficiency and output. So secondly, we also faced a challenge in monitoring partner health facilities, whose impact we noticed progressively dropped following initial launch and implementation in their various sites. So there was the need to keep them constantly motivated towards the venture. We were able to learn from the successes of similar ventures from Africa and all around the world, and bring in better strategies to improve these partnerships and ensure continuous productivity from partner hospitals. And thirdly, we had the difficulty tracking and implementing lessons learned from initial pilots, which we carried out from different sites. And thanks to this technical assistance still, we obtained an operations manual that supports and facilitates learning, replication, and the scale of our venture to new sites. Next slide, please. So we learned a lot from this process, but let me share with you a few of the most pertinent points. So first thing is that we noticed we use evidence in the form of maybe published research, for example, to showcase the impact of our venture. This can facilitate the integration and acceptability of our venture to new sites. And also it can help to secure more partnerships from bigger organizations that can help us easily scale and bring our venture to new sites. And secondly, we learned that conducting pilots and documenting feedback and lessons learned in a company document such as an operations manual can improve our business model and enable easy understanding of all concepts, especially for new team members and new partners. Thirdly, we learned that if frontline health workers, who are actually the key players in the implementation process for our venture, if these frontline nurses are well motivated, they will better promote our services and guarantee sustainability of the venture in the long run. And lastly, following the landscape surveys, we understood that we can leverage on our current technology and also integrate other diagnostic procedures to create more impact through our venture. Next slide, please. So, good, thanks. So for our next steps, we plan on, in the following months, conducting clinical trials in partnership with MSF Epicentre to build enough evidence of the health impact linked to our venture. We also plan on securing administrative clearances at national level with the Ministry of Public Health, and also move an extra step of getting some of our technologies FDA registered and obtaining CE mark as well. And we will also progressively continue establishing partnership with health facilities, both in the public and private sectors, which will serve as a foundation to enable us easy scale our venture and take them to new sites. And lastly, we'll be leveraging on our existing technologies to target new diseases. And thanks to a partnership with Ingolstadt University in Germany, who have some of their students currently carrying out some master's thesis on this part of the venture, we believe by the end of this year, we'll be able to diversify our offer and create more impact in terms of healthcare, especially at the base of the pyramid level. Next slide. So in a nutshell, we are emerging with a more solid foundation for our venture to grow, a better implementation model, which will facilitate scale. And again, thanks to this technical assistance, we are now on track to create the impact we desire and contribute to ameliorating healthcare in our context, especially at the base of the pyramid level. So thanks a lot for listening and joining this webinar, and looking forward to the discussions.
Thank you, Conrad, for sharing your innovation that strives to provide universal access to breast and cervical care, screening and treatment in collaboration with public sector health centers in rural areas. I also appreciate your comments on the impact of the TA on your organizational structure, the partnership monitoring, and also about strategic learning. So thanks for that. I would now like to ask April from LHSS to speak more about the technical assistance to the Inclusive Health Access Prize winners. April?
Thanks so much, Tara. Next slide, please. So I want to start by giving you a brief overview of our process for delivering TA. We had about 1 year for this activity, and so we worked to first assess needs together with the IHAP winners, asking them about their top challenges and priorities. And then together we co-designed TA plans that focused on one primary need given the sort of short time frame, but we also included secondary areas of support that had come up in our discussion. We delivered TA through a mix of project experts as well as external partners that we identified that had unique skill sets that met the winners' needs. And what I really want to stress is that the winners here were partners and essentially our customers throughout this process. So in some cases, they interviewed the consultant to work with them before we contracted them. In other cases, we changed consultant deliverables midway to ensure they were really going to be responsive to winner needs. So it was really a true partnership because we wanted to make sure that what we developed in this short time was going to be useful and would outlive our engagement. Next slide. So what did we learn from this process? We actually learned a lot more than this, but we have more of that coming soon in our report and learning brief. For now, I'll just share a few key lessons. So the first is that a demand-driven and flexible approach is central to effective TA. Our focus on acute and individual needs as defined by the winners really helped facilitate close collaboration and engendered ownership of the TA process and outputs by the organization. And then flexibility was really a key success factor that was identified by both the winners and the TA providers. As the TA providers learned about the winners' businesses, they were able to kind of adapt their support approach to meet their needs. Second was that adapting to 100% remote TA in response to COVID-19 prolonged our TA delivery process, but enabled broader engagement. So going fully remote led to some delays. We made some changes in our TA plans. For example, it also took TA providers a little bit longer to build rapport with winners and thus to really fully understand their business models, their team dynamics, organizational challenges. You know, it's not easy to first time you talk to someone on the phone to tell them about your deepest challenges. But the unexpected benefit that we found was that full teams from the winner organizations were able to participate in these TA sessions. And that was a result both of using virtual platforms as well as holding shorter meetings over a longer period of time. Third, in upper right, external business assessments are very valuable and can shape an innovator's strategic direction. So winners shared that what they found most useful about our TA was receiving external expert examination of their business models and operations, and then strategic guidance on how to move forward. This process gave them the opportunity to take a step back from day-to-day operations and really question some of their business model assumptions. And finally, private innovators value support rooted in global best practices and opportunities to learn from peers and network. So while our primary TA integrated global experiences and learning because our TA providers had the chance to work across so many different contexts, we had structured our networking and peer-to-peer learning support to be much more demand-driven and ad hoc, and we ultimately didn't receive that many requests from the winners for this. So we think that future initiatives might consider intentional integration of networking and peer-to-peer exchange, you know, at regular intervals to ensure that busy entrepreneurs can take advantage of these opportunities. Next slide. So through our TA and learning process, we also gathered some insights on the challenges that private innovators face to scaling and supporting health systems goals. The first is that access to finance is the primary barrier to scaling up innovators' health services. So winners described having limited capital to allow them to pilot innovations, to learn and adapt, to hire people, and to invest in entering new markets. And this is a common challenge among private innovators. Second is that insufficient number and quality of human resources impedes the ability of private innovators to achieve sustainability and scale. So private health innovators have lean teams. They often have gaps in their organizational structures or team members that are serving two roles at once. And they face challenges attracting talent and competition from global development firms able to offer higher salaries. Third is that balancing business sustainability and health impact is challenging for health innovators. I know that many in the public health space often voice the worry that private companies focus too much on profit. But our TA providers share that they thought the winners focused a little bit too much on health impact, as well as some of the technical aspects of their solutions, rather than how they were going to make their business sustainable. And finally, limited visibility of private health innovators constrains their ability to forge the partnerships they require to scale. While IHAP winners offer these really unique solutions that have the opportunity to expand access to essential services in their context, they're still relatively unknown to key government officials and other important stakeholders. And when they do work with government, they often interact at lower levels of government, like district health offices and local public health facilities. So it's kind of an inefficient way to get to scale with the government. Next slide. So I want to wrap up with three overarching recommendations. The first is that given their challenges with access to finance and visibility, supporters should seek to grow the networks of private innovators, making introductions across the financing and partnership spectrum, considering Ministry of Health contacts, investors, USAID missions, philanthropic funders, and others. The second is, we need to provide technical support that private innovators can't find somewhere else. These are small, stretched teams, and we want to make sure we're making good use of their time, which in turn ensures good value for money for funders. Demand-driven and participatory TA really ensures that support is integrated into the organization's team and priorities, and that the right people make time to engage. And then finally, even though it's important to be demand-driven, external assessments by experts are really useful. We saw this both through the organizational capacity building assessments that we facilitated with each winner organization, as well as the initial diagnostic phases of all of our primary TA. These external eyes and questions can really help innovators see and address issues that are impeding their dual health impact and sustainability goals. Next slide. So I just want to wrap up by thanking all of our technical assistance providers. A lot of different firms and individuals were involved in the support. And next slide. Thank you to all of you for joining the webinar and look forward to the discussion.
Great. Thank you, April, for sharing lessons learned from this TA activity, especially concerning the demand-driven approach and the co-designing TA for a balance of, I think, both the tailored support for individual needs and also addressing some of the common challenges for the winners. The poll is now open. The poll is now open for your comments and feedback on the webinar, so please do take a moment to provide some feedback. We appreciate that. And we welcome your questions. I believe the slide is there to show how to ask questions in the chat box. And I would like to encourage our audience to submit those questions through those means, and we very much want to encourage your participation in this discussion. So just to kick it off, a first question. This one is for Nika. If you could please talk about how you're working with the public health system, and what is one thing that the government can do to help you achieve greater impact? Thank you.
Thank you, Tara. So in terms of the government, the reality is that our partnerships with governments are critical to really help us provide that or create that connected ecosystem that facilitates optimization of holistic support for people. And so we work with government across kind of three major ways. Firstly, we're on Federal Ministry of Health and State Ministry of Health technical working groups related to NCDs and more. And then the second is that healthcare facilities see us as complementary to the existing healthcare system because we focus on self-care support and we focus on providing it largely digitally or through this hybrid approach that I highlighted before. And so we work directly with public facilities, primary care centers, secondary hospitals, helping to directly take pressure off the system by providing digital self-care support that more or less focuses on education and prevention, enabling them to then focus on other areas. Many times we try to ensure that we're aligned, even in terms of the messaging that we collectively provide patients. And then lastly, we very much focus on health education of providers themselves. We train healthcare workers through our partnerships with the University of New Mexico Project ECHO, as well as Healthcare Leadership Academy of Nigeria. And through our virtual teleeducation sessions, to date, we've had over 80 healthcare facilities receiving training through this model. And so when it kind of comes to the one thing that would help when it comes to government, I could list a whole number of elements, but I'll prioritize one. And the reality is that, COVID, I guess one of the few positive things about COVID is that it has upended the notion that digital health can't work, literally overnight. And so the government has done a lot, I think, around investing in telehealth. But I think that it would help if our government really focused on investing in creating kind of that enabling ecosystem for telehealth to really flourish and scale. And I would say this not just for Nigeria, but really across Africa, so that it's accessible to all. We have amazing smartphone and mobile phone penetration rates across people, across women. But we need a lot more to ensure that all people have access to support and care through mobile phones. In fact, some countries have implemented zero rating for health websites, meaning that accessing these sites from a data standpoint is free. And how can our government potentially support areas like that? Because it would not only help the patient population access preventive, promotive, and palliative care, but would also help our healthcare workers, who we have found have such a thirst for quality education, but who have issues in terms of barriers to access, sometimes just because they don't have the money for accessing data for their phones or laptops. So even just focusing on that as one element of creating that enabling ecosystem would help us and so many other players in this arena tremendously.
Great, thank you. Thank you for that answer. The next one, if we could ask for Conrad, if you could please talk a little bit about or share an example of how the technical assistance was demand driven or adapted to meet your needs. So a little more details on how that process went. Thank you.
So organization centered and organization focused. So it was far different from what you could find in some sort of incubator or accelerator program, such that they already have a pre-established program where you get in as a startup or you get in as a venture, and you first have to talk about your problem, talk about the marketing. You follow a particular curriculum. This was ideal in such a way that every organization was treated differently. We had to first of all go individually, understand our pain points, then select the most pertinent, which experts could come in and brainstorm or give in their ideas and propose solutions and help us read from one step to the other. Something pick up that organization is IMESH model. So we actually use them of it and using them to carry on a task. So it means a lot. It means low productivity, low impact and low output for organizations. We were facing an initial challenge in the sense that we had a series of pilots and we had results from diverse sites and diverse contexts, and we had a difficulty synthesizing all this feedback into a unique model where we could say, okay, we are scaling this approach. And secondly, we had noticed over time that there was a progressive decrease in the output of our partner health facilities after we did an initial launch. For example, when we get in contact with the health facility and train, and this we usually organize a screening campaign. And the screening campaign was usually 100, 150 presenting per day to get screened. But progressively, after that, we discovered the number of women presenting in these facilities to get screened dropped over time. At the beginning, we thought it was a problem of communication and sensitization, but with the technical assistance, we were able to dissect and detect that it was at the level of the health facilities and the actors themselves, those the nurses. And on this, we had to put in strategies with inputs from some experts on how we could better stimulate and make this help more
Conrad? Conrad, you're breaking up. Would you be able to turn off your video just for a moment so we can hear you better?
to productive in the site. So I mean, I was can you hear me now?
Yes, if you turn off your video, I think it helps improve it. Thank you.
Oh, great. So yeah, so we work with experts and we were able to detect that pain, and with the few trials based on recommendations, we could get to a standard where we've got the right formula to keep the partner health facilities and their nurses up to date and more motivated towards the project. So this has been a huge step, a huge input for our venture, and integrated into our operations manual. It's a strategy I think we can easily scale, and it's going to create the impact we really desire.
Great, thank you very much. There have been a few questions on finance. So maybe if the panelists could please speak to the revenue generation models that they use and how you're financed, especially if they're raising capital or if they're subscription based and things like that. We can just go through each of the winners. So start with Adama, please, and then go to Neka and then Conrad. Thank you.
Okay, thank you. So in terms of percentage, so we finance our first months and years from CSR activities, meaning that so private enterprise in Senegal. So they found that our project idea was very good, and then they just put money. So first of all, to build the app, so the first version of the app was fully paid by a private by a local mobile operator, and so on our business model. So our revenues, they come from so we take 5% from the fund, so the NGOs or so the foundations they put on our platform, because so like I already explained, so we allow so the NGOs and the foundation and the health association so to put so to buy points on our platform and then to give those points to their targeted population, so that those population can go to the pharmacies and buy the medicine, and with our platform they can follow every dollar spent on because they have a real-time basis statistics on their funds, and so our business model was to take 5% from those funds, and what we have seen that so for people, they just make trials. They don't put a huge amount of money, and that's why this model was not very sustainable. And I must say that also, so we had won many prizes for 5 years now, and all the cash from those prizes was put in in our activities, so to make it sustainable. Thank you.
So when it comes to us at mDoc, from a business model perspective, we are B2B2C. So we have contracts with businesses that allow us to provide self-care support to their populations, and then we're B2C. Now, if you kind of look at us over the last few years, we've been primarily funded through just bootstrapping. We've been fortunate to receive grants from funders who are willing to invest in non-traditional startups. and also awards such as the Inclusive Health Access Prize as well, just as Adama has highlighted. And then a lot taking all the revenue that we've generated and plowed it back into our organization. I'll say that we've been intentionally slow about focusing on VC funding yet, but we are planning to raise our seed round Q3, Q4. And we've been intentionally slow because we are so focused on impact. I think April made the great point that so many of us are so focused on impact that it's sometimes it's hard to link both impact with the business model. But we want investors that understand that healthcare on this continent is so difficult, it's complex, and are willing to work with us and be, not just financiers, but people who are willing to work with us to create what, help us achieve our vision of becoming a scalable business that is able to provide low-cost quality care to low-income populations that ultimately is not reliant on grants. I mean, there are very, very, very few examples across the continent today. And for us, I mean, this is one of the most critical. We want to demonstrate that this can be done on this continent. Hence, our reservation for the last couple of years, we really wanted to get our model right. We wanted to be able to show that we could have impact on population health outcomes. We wanted to be able to show that there was truly product market fit, that there was demand. We've been able to do that, and we're just teeing it up so that we are completely investor ready for Q3, Q4.
Great. So for us, I mean, we have a similar pathway like the others. At the beginning, we had to bootstrap, and along the line, we were lucky enough to get a series of grants to help us take the venture to a further level. And of course, it's as Ken mentioned, it's very, very difficult, especially for a healthcare startup that is trying to create impact, to get investment in the form of angel investment or VC funding at the start. There's usually a lot of question marks and a lot of fear. I mean, on the part of investors, there's really a lot of reluctance in that domain. Great. Now, in terms of our business model, we first of all have a unique implementation model. What we do is that we provide all our technologies, all consumables required, as well as training to the partner health facilities free of charge, so for no upfront cost. And then we engage in some sort of revenue sharing scheme when women get screened through our technologies. So yeah, that's actually our model. So we get these health facilities, they get everything for free, the training for free, access to training platforms, on-site training for free, technologies for free, and then we go into a revenue sharing model.
Oh, thank you to everybody for that those responses. Here's a question for everybody. If you could you share to what degree the winners were able to exchange views and learn from other startups, each other, or expanding health businesses? Are there enough forums for these exchanges? I asked maybe April if you could talk about that from the TA perspective, and then over to Adama, Neka, and Conrad. Thank you.
Sure, thanks. So this is one of the lessons I was trying to kind of point out as something that we could have done better. We did offer, kind of based on the winner's interest, we offered a session on working with USAID and USAID implementing partners. And in that session, we had some representatives from USAID, but we also had a social enterprise in the health space from Kenya who had worked successfully with some USAID implementing partners and DFID, among others. So we did give that opportunity, but I think my experience in the past had been that it's hard to get, when entrepreneurs are busy, to get them to participate in these networks and just kind of organically do learning exchanges, and it's hard to make time for those. So we had just thought that, if they ask for it, we'll give it to them, or if they want to be introduced to someone, we'll do that. But I'm sure, I think that kind of pull approach was maybe too hands off. So would love to hear from any of the winners that have thoughts about, do you guys have access to ways to interact with your peers and learn from others across the globe, or is that something that it needs to kind of be created? Just if anyone has any thoughts, you don't all have to.
Yeah, I'm happy to jump in. So entrepreneurship is lonely. Being an entrepreneur running an impact-driven social enterprise, I believe, is even lonelier. And so I do think, despite us working 24/7 around the clock, I do think it's important to have those forums where we can share and learn with each other. I think they're actually critical. I think just even in talking about the winners, when we, at the launch, we all, or some of us were able to be present physically at the launch in New York. And that was incredible. Just having the ability to share with each other, share our visions, share our challenges, learn from each other. So I definitely think there are opportunities to leverage digital to kind of facilitate that exchange. And I can also see how on the other side it might be really tough because getting email responses from us because we're doing 5 million things may be really difficult. But I've found that when those facilitated learning exchanges or platforms exist, they can be incredibly helpful to us. I highlighted earlier that our team said having the LHSS support from MPA Global Advisors was like group therapy. And honestly, sometimes it's so hard doing this work that just knowing that there are other people who are out there who are struggling with the same struggles you have, but may have come up with the best practice or an idea would be great. But my only caution is, I think at the same time, I have seen forced learning platforms where, an expression, I'm going to be frank, in the development world, where it's, all of us are private sector enterprises trying to figure out what our value proposition is, what our sustainable business models are. And so not in this forum, but in other forums, there have been areas where, almost artificial networks are created of people who are actively, clearly competitors. And so I think it's understanding and I think being humble about understanding what that environment is, understanding, what potentially shared needs are, despite that, despite the enterprises being competitors, and building on that and trying to understand that and then building on that to facilitate the learning. Because sometimes it can be difficult when we've been in situations where funders or other organizations haven't understood, that there is some competitive element. And I would say this cuts across NGOs and for-profit organizations that are all, still trying to deliver impact.
Okay, so I'm going to jump in. So I think that the winners have a WhatsApp group. So and we created so in New York. So when we met in New York, and I think that some information have been shared in this group. So I must say that it is not frequent, and Monica just pointed out. So maybe we don't have enough time, so we're all trying to survive in our own environment, and that's why maybe it is very hard for us to to share more. But so how this question is raised, I think that maybe after this workshop, so we'll try to improve our our exchanges, because it's very important. So I must also share that here in Senegal, we try to build a health startup association, and I was elected president, but we just met twice, and then people, because people, in Africa, the health startups, they're trying to survive. I think that people, they don't have enough time for meetings and so. But so it is a good point, and maybe it is a path to be explored. Thank you.
just to chip in something right on the importance of collaboration. An example from my context, especially, I give an example, right? You're building a health startup, a mobile health startup in Cameroon, for example, and we don't have any national policies on data privacies in healthcare or validating such concepts. Or I go a further step. If you're developing a hardware medical device, we have no policies, no organizations, no bodies in place to certify what you're actually doing. You must go outside. And going outside is actually collaborating with people doing something similar to what you're doing, to get advice, to have the right pathway, to have the right connections and right networks to, either validate what you're doing or know the best strategies to better implement what you're doing. And I give another simple example. Say one of our hardware products, it's been certified and validated in Cameroon, for example. I bet if we get to Nigeria tomorrow, that validation or that certification means almost nothing because they have their own process. If you get to Kenya, it becomes something else because they have their own process. But I give an example of something we've learned. When technologies come from outside and they are maybe FDA registered or FDA certified, they have more value being implemented and they can be easily implemented in our context compared to things which are certified locally. So such networks and interactions to give you an insight on things like this can really facilitate you to, especially in your early stages, to get new ideas very fast and adopt practices that can help you better implement your project and especially scale in the sub-Saharan African context.
Great, thank you for that. I think we have time for just one more question. Here's one from earlier on. Back over to you, Conrad. Could you share what strategies you found that help motivate? About that being one of your challenges.
Okay, great. Yeah. So, the first thing we discovered is that more motivation was one of the factors. So we had to redefine our business model, our revenue sharing model in such a way that they get more motivated. And secondly, in order to make them adhere to the project and keep on using our technologies, we had to find a way to diversify our technology offer. I give an example. We are bringing a digital microscopy system there where they can capture slides of breast cancer, for example. But these as well can be used to capture and analyze the regular slides for malaria or for intestinal parasitic infections. So if they can use the technologies as well in their routine activities, they are more motivated to use these technologies. And thirdly, we had to go a further step to give them a free and open access to our e-training platform so that they can get continuous professional development courses, and also give them a direct link with health experts where, apart from activities linked towards the project, they could interact with medical experts who are present in cities and have one or two advices whenever they need. So it was actually increasing their remuneration and diversifying our technology offer in such a way that they can use it for their routine workflow, and in such a way they are more attached to the project and they can better implement.
Fantastic. Thank you. Thank you for that answer. I think we're just about out of time. This has been a really great discussion. I want to thank all of our prize winners and presenters today for taking the time to share. And I would like to thank everybody, the participants, for joining the Strengthening Health Systems by Supporting Innovative Health Businesses webinar, and for engaging with such thoughtful questions. I'm sorry we couldn't get to all of your questions, and I do hope everybody has enjoyed the webinar. We'll be sending out a recording of today's webinar next week, so it will come to your email for those of you who registered for it. Thank you again to all, and I wish you a wonderful day. Thank you.